Hello everyone, I'm Huma Qureshi and I welcome you to our special health series, Aapke Liye, an anemia awareness program from Ajanta Pharma, wherein we dive into conversations around everyday health concerns that often get overlooked, and one such issue that affects millions of people, especially women, but often goes undiagnosed or ignored: anemia. If you've ever felt unusually tired, dizzy, please don't ignore, as this might be something worth paying attention to and help us understand what anemia really is and why it matters. I'm joined by an expert who'll walk us through the science, causes, and most importantly, what we can do about it. Doctor, please help us understand what iron deficiency anemia is and how common it is amongst Indian women, especially during pregnancy.
Thank you, Humaji, for asking me this very important question on iron deficiency in the women. So, iron deficiency is very common in the Indian females, and we see mostly the Indian females have a lot of deficiency of iron, and anemia is the most neglected part of the whole spectrum of diseases that we see. So, this is a very common, like maybe 80% of the women we see in our OPDs have iron deficiency anemia in some form or the other.
So, what is the ideal hemoglobin level for women both during pregnancy and otherwise? And what are the main causes of iron deficiency anemia in both these groups? Do the risk factors differ? Right.
So, for a healthy woman, the ideal hemoglobin should be around 12 milligram percent. But what we see in a pregnant woman, even up to 11 or 11.5 is considered to be normal. But in the Indian scenario, mostly what we see is girls or women coming in with the hemoglobin level of maybe 10 or 9 or sometimes even 8. So we can say that this problem of anemia is very common, and very rarely we see girls with the 12-gram hemoglobin.
So, what are the signs and symptoms of iron deficiency anemia during pregnancy, and how does it affect the mother and the fetus?
See, what happens in pregnancy is that iron is needed for the growth of the baby and for the women's well-being. And if it is not met, the iron requirements are not met, then symptoms of anemia, they appear. So the symptoms which are most common are like feeling of breathlessness, weakness, fatigue, then cramps in the legs, or lack of sleep, headache, and sometimes increased heartbeat. Patient can just complain of palpitation. So all this in severe cases there is a feeling of swelling of the lower limbs or even in the abdominal area, and development of ascites may happen. So ye sab cheezein, these are all the signs and symptoms of anemia. Or any doctor who, or any first line provider, whoever comes in contact with pregnant women, if they feel that patient is showing these kind of signs, then they should be checked definitely for anemia.
So, does the Indian diet meet the increased iron needed during pregnancy? And what are the possible detrimental effects of anemia on the mother and fetus?
See, sometimes iron tablets can give you some side effects like constipation or hard stools or stomach pain, cramps, or maybe even a little bit of nausea. And of course, black stool is known in with some salts. So the tips to reduce these side effects is that they must be taken after meals, and then they must not be, and they should be, person should take a lot of water and lot of dietary fiber, so that there is no constipation. And if you are still not comfortable with the iron tablet, then we can ask your doctor to change the prescription. And of course, in severe cases, we may even prescribe the intravenous iron therapy, the parenteral iron therapy, for achieving quick recovery of the very severely anemic patients. So thank you so much for asking all these relevant questions for anemia. And I'm sure with this talk, everybody will be benefited, and we will have an anemia Mukt Bharat very soon.
What are the common side effects of oral iron supplements, and what measures do you suggest to reduce these side effects and ensure better compliance?
So this question has two parts. Like one part is that whether the
Right.
diet fulfills the iron needs, and the second part is what is the effect of the anemia on the mother and the fetus. So coming to the first part of the thing is that Indian diets may generally the routine diets in our ancestral heritage जो है pulses and rice and cereals, they were all providing the iron. But अभी जो recent fads हो गए हैं of using more of fruits and coconut water, all that is not have providing the iron. So that is why we are seeing more of the iron deficiency. So the diet which is good in iron is that they can have this iron, green leafy vegetables, then pulses, then good jaggery and meat. Non-vegetarians जो है, they can have the red meat or the chicken or fish. Also, many foods in our diet are like if you take the tablet with iron, too much of tea and coffee, that reduces the iron absorption. So then we have to tell the patient that you have to take it along with the meal and not along with any tea or coffee. So only diet is if you monitor and if you just change the diet, that is not sufficient to meet the high dietary requirement of iron, high requirement of iron in the pregnancy. So along with the diet, we must supplement the iron therapy in some form or the other, and most of the iron which is required by the fetus and of course by the mother. So the effect of anemia in the mother is that the mother.
Thank you, doctor, for sharing your valuable insights and guiding all of us on anemia and its management for better outcomes. Thank you.